This is a read aloud of Antibiotic Resistant Threats in the United States 2013 PDF article. Provided by the CDC, U.S. Department of Health and Human Services, Centers for Disease Control and Prevention. We are going to go through pages 13 through 17, then pages 50 through 52, and then finally pages 58 through 62. 14 pages altogether. National summary data. Estimated minimum number of illnesses and deaths caused by antibiotic resistance, at least 2,049,442 illnesses, 23,000 deaths, bacteria and fungus included in this report. Estimated minimum number of illnesses and death due to C. difficile, a unique bacterial infection that, although not significantly resistant to the drugs used to treat it, it's directly related to antibiotic use and resistance. At least 250,000 illnesses, 14,000 deaths. Where do infections happen? Antibiotic resistant infections can happen anywhere. Data show that most happen in the general community. However, most deaths related to antibiotic resistance happens in healthcare settings such as hospitals and nursing homes. How antibiotic resistance happens. 1. Lots of germs. A few are drug resistant. 2. Antibiotics kill bacteria causing the illness, as well as good bacteria protecting the body from infection. 3. The drug-resistant bacteria are now allowed to grow and take over. 4. Some bacteria give their drug resistance to other bacteria, causing more problems. Examples of how antibiotic resistance spreads. Animals get antibiotics and develop resistant bacteria in their guts. Drug-resistant bacteria can remain on meat from animals. When not handled or cooked properly, the bacteria can spread to humans. Fertilizer or water containing animal feces and drug-resistant bacteria is used on food crops. Drug-resistant bacteria on the animal feces can remain on crops and be eaten. These bacteria can remain in the human gut. George gets antibiotics and develops resistant bacteria in his gut. George gets care at a hospital, nursing home, or other inpatient care facility. George either stays home and in the general community spreads resistant bacteria, or resistant germs spread directly to other patients or indirectly on unclean hands of healthcare providers. Resistant bacteria spread to other patients from surfaces within the healthcare facility. Patients go home. Simply using antibiotics creates resistance. These drugs should only be used to treat infections. Here is a chart. Minimum estimates of morbidity and mortality from antibiotic-resistant infections. And a continuation of that chart. a continuation of that chart again. Threat level urgent. These bacteria are immediate public health threats that require urgent and aggressive action. These are the 3 microorganisms with a threat level of urgent. First one is Clostridium difficile, or I'll just call it CD. It's called shortened to C difficile, but I'll call it CD. 250,000 infections per year, 14,000 deaths, 1 billion in excess medical costs per year. Threat level urgent. This bacteria is an immediate public health threat that requires urgent and aggressive action. C. difficile causes life-threatening diarrhea. These infections mostly occur in people who have had both recent medical care and antibiotics. Often CD infections occur in hospitalized or recently hospitalized patients. Resistance of concern. Although resistance to the antibiotics used to treat C. difficile infections is not yet a problem, the bacteria spreads rapidly because it is naturally resistant to many drugs used to treat other infections. In 2000, a stronger strain of the bacteria emerged. This strain is resistant to fluoroquinolone antibiotics, which are commonly used to treat other infections. This strain has spread throughout North America and Europe, infecting and killing more people wherever it spreads. Public health threat. 250,000 infections per year requiring hospitalization or affecting already hospitalized patients. 14,000 deaths per year. At least 1 billion in excess medical costs per year. Deaths related to CD increased 400% between 2000 and 2007, in part because of a stronger bacteria strain that emerged. Almost half of infections occur in people younger than 65, but more than 90% of deaths occur in people 65 and older. About half of CD infections first show symptoms in hospitalized or recently hospitalized patients, and half first show symptoms in nursing home patients or in people recently cared for in doctors' offices and clinics. Fighting the spread of resistance. What CDC is doing. Tracking and reporting national progress towards preventing CD infections, promoting CD prevention programs, and providing gold standard patient safety recommendations, providing prevention expertise as well as outbreak and laboratory assistance to health departments and healthcare facilities. What you can do. CEOs, medical officers, and other healthcare facility leaders can support better testing, nucleic acid amplification tests, tracking, and reporting of infections and prevention efforts, ensure policies for rapid detection and isolation of patients with CD are in place and followed, access hospital cleaning to be sure it is performed thoroughly, and augment this using an Environmental Protection Agency approved spore killing disinfectant in rooms where CD patients are treated. Notify other healthcare facilities about infectious diseases when patients transfer, especially between hospitals and nursing homes. Participate in a regional CD prevention effort. Healthcare providers can prescribe antibiotics carefully. Once culture results are available, check whether the prescribed antibiotics are correct and necessary. Order a CD test, preferably a nucleic acid amplification test, if the patient has had 3 or more unformed stools within 24 hours. Be aware of infection rates in your facility or practice and follow infection control recommendations with every patient. This includes using contact precautions, gloves and gowns, and isolation for patients who are suspected to have CD, and continuing those practices for those with positive test results. Patients can take antibiotics only as prescribed by your doctor and complete the prescribed course of treatment. Antibiotics can be life-saving medicines. Tell your doctor if you have been on antibiotics and get diarrhea within a few months. Wash your hands before eating and after using the bathroom. Try to use a separate bathroom if you have diarrhea, or be sure the bathroom is cleaned well if someone with diarrhea has used it. Threat level: serious. These bacteria are a serious concern and require prompt and sustained action to ensure the problem does not grow. Microorganisms with a threat level of serious, and there are a lot of them. There they are. Multidrug-resistant Acinetobacter, 7,300 multidrug-resistant, I'm just going to call it AB infections, 500 deaths from multidrug-resistant infections, 12,000 AB infections per year. At least 3 different classes of antibiotics no longer cure resistant AC infections. Threat level: serious. This bacteria is a serious concern and requires prompt and sustained action to ensure the problem does not grow. AB is a type of gram-negative bacteria that is a cause of pneumonia or bloodstream infections among critically ill patients. Many of these bacteria have become very resistant to antibiotics. Resistance of concern. Some AB strains are resistant to nearly all or all antibiotics, including carbapenems, often considered antibiotics of last resort. About 63% of AB is considered multi-drug resistant, meaning at least 3 different classes of antibiotics no longer cure AB infections. Approximately 2% of healthcare-associated infections reported to CDC's National Healthcare Safety Network are caused by AB, but the proportion is higher among critically ill patients on mechanical ventilators, about 7%. Public health threat: an estimated 12,000 healthcare-associated AB infections occur in the United States each year. Nearly 7,000, or 63% of these, are multi-drug resistant, and about 500 deaths are attributed to these infections. And we can take a look at that chart there. Fighting the spread of resistance. What CDC is doing. Tracking illness and identifying risk factors for drug-resistant infections using 2 systems, the National Healthcare Safety Network and the Emerging Infections Program. Provide outbreak support such as staff expertise, prevention guidelines, tools, and lab assistance to states and facilities. Developing tests and prevention recommendations to control drug-resistant infections, helping medical facilities improve antibiotic prescribing practices. What you can do, states and communities can know resistant trends in your region, coordinate local and regional infection tracking and control efforts, require facilities to alert each other when transferring patients with any infection. Healthcare CEOs, medical officers, and other healthcare facility leaders can require and strictly enforce CDC guidelines for infection detection, prevention, tracking, and reporting. Make sure your lab can accurately identify infections and alert clinical and infection prevention staff when these bacteria are present. Know your infection and resistance trends in your facility and in the facilities around you. When transferring a patient, requires staff to notify the other facility about all infections. Join or start regional infection prevention efforts. Promote wise antibiotic use. Healthcare providers can know the type of drug-resistant infections that are present in your facility and patients. Request immediate alerts when the lab identifies drug-resistant infections in your patients. Alert the other facility when you transfer a patient with a drug-resistant infection. Protect patients from drug-resistant infections. Follow relevant guidelines and precautions at every patient encounter. Prescribe antibiotics wisely. Remove temporary medical devices such as catheters and ventilators as soon as no longer needed. Patients and their loved ones can ask everyone, including doctors, nurses, other medical staff, and visitors, to wash their hands before touching the patient. Take antibiotics exactly as prescribed. Drug-resistant Campylobacter. Okay, this one's going to be CL. 310,000 drug-resistant CL infections per year. 1,300,000 CL infections per year, 13,000 hospitalizations, 120 deaths. Threat level serious. This bacteria is a serious concern and requires prompt and sustained action to ensure the problem does not grow. Campylobacter, or CL, usually causes diarrhea, often bloody, fever, and abdominal cramps, and sometimes causes serious complications such as temporary paralysis. Resistance of concern. Physicians rely on drugs like ciprofloxacin and azithromycin for treating patients with severe disease. Resistant infections sometimes last longer. CL is showing resistance to ciprofloxacin, azithromycin. Public health threat. CL is estimated to cause approximately 1.3 million infections, 13,000 hospitalizations, and 120 deaths each year in the United States. CDC is seeing resistance to ciprofloxacin in almost 25% of CL tested, and resistance to azithromycin in about 2%. Costs are expected to be higher for resistant infections because antibiotic-resistant CL infections sometimes last longer. We have a chart and a graph here. Fighting the spread of resistance. CL spreads from animals to people through contaminated food, particularly raw or undercooked chicken and unpasteurized milk. Infections may also be acquired through contact with animals and by drinking contaminated water. Antibiotic use in food animals can result in resistance CL that can spread to humans. Resistant CL are common in many countries and cause illness in travelers. Key measures to prevent resistant infections include avoid inappropriate antibiotic use in food animals, tracking antibiotic use in different types of food animals, stopping spread of CL among animals on farms, improving food production and processing to reduce contamination, educating consumers and food workers about safe food handling practices. What CDC is doing: tracking changes in antibiotic resistance through ongoing surveillance, promoting initiatives that measure and improve antibiotic use in food animals, determining food responsible for outbreaks of CL infections, supporting and improving local, state, and federal public health surveillance, guiding prevention efforts by estimating how much illness occurs and identifying the source of infection, educating people about how to avoid CL infections. What you can do: clean. Wash hands, cutting boards, utensils, sinks, and countertops. Separate. Keep raw meat, poultry, and seafood separate from ready-to-eat foods. Cook. Use a food thermometer to ensure that foods are cooked to a safe internal temperature. Chill. Keep your refrigerator below 40 degrees Fahrenheit and refrigerate food that will spoil. Avoid drinking raw milk and untreated water. Report suspected illness from food to your local health department. Don't prepare food for others if you have diarrhea or vomiting. Be especially careful preparing food for children, pregnant women, those in poor health, and older adults. Consume safe food and water when traveling abroad.